We'll also study about the HBD, okay, hepatitis D virus. And hepatitis D virus is pretty important, okay, because the hepatitis D virus is a defective virus and cannot replicate by itself, depends on the HBV, okay, hepatitis B virus for its survival. Protein coat is made up of single protein called hepatitis D antigen, okay. Transmission is similar to that of hepatitis B and hepatitis C. Parental route is the most common, followed by sexual and vertical transmission. So basically this thing has a HD antigen, okay, hepatitis D antigen. Now the main question from here can be HDV and HBV association. The association of HDV and HBV is of two types, co-infection and superinfection. Co-infection, it occurs when a person is exposed simultaneously to serum containing both HDV and HBV. Okay. Superinfection, it occurs when a chronic carrier of HBV, okay, hepatitis B virus is exposed to serum containing HDV. So superinfection, so basically co-infection, हेपेटाइटिस बी इन्फेक्शन सेट्स इन फर्स्ट तो को इन्फेक्शन होगा तो पहले HBV होगा, सेट्स इन फर्स्ट, और HBS एंटीजन होगा which becomes available for the HDV antigen. Now this thing helps to grow the HDV, okay. This is usually a transient and self-limited condition and it is clinically indistinguishable from hepatitis B acute hepatitis, okay. It rarely progresses to chronic stage, okay. That's it. In superinfection, what happens is that HBV chronic carrier is exposed to HDV and then it happens. And co-infection is when both of them are happening together, and in superinfection you have HBV, then you get a superimposed HDV. So there's an acute phase where the HDV replicates. For the superinfection, there is an acute phase where the HDV replicates actively with high transaminase levels, with suppression of HBV, okay. Chronic phase में patients progress to chronic stage, वहाँ पे क्या होता है कि HDV का replication कम हो जाता है और HBV का replication बढ़ जाता है, with वैसा है, हाँ. And this can lead to hepatocellular carcinoma, cirrhosis and anything else. So the main difference between them is definition wise, that co-infection में क्या होता है. This is the main question they will ask, okay. Hepatitis, difference between hepatitis D and hepatitis B virus, co-infection and superinfection, okay. So main thing they can ask is the definition. HBV and HDV infection occurs simultaneously for co-infection, but superinfection में HDV infection occurs to an already person suffering from a carrier of HBV virus. Patient status, co-infection में patient is pretty healthy only, it is self-limited. But patient status for superinfection is that he's already been suffering with HBV, okay. It's an HBV carrier, B carrier. Risk of development, ठीक है, fulminant disease, fulminant hepatitis, okay. Risk of development of fulminant hepatitis is more than that of HBV alone. So basically, if you only had HBV, the risk wouldn't be that much, but if you had HBV plus HDV, then the fulminant disease infection is more, co-infection. And superinfection is something like you're already suffering from HBV and then you had HDV, so here the chances are more than that of co-infection. Chronic hepatitis के लिए co-infection is chronic hepatitis, risk of chronic hepatitis, the co-infection is rare और superinfection is much more, okay. So जो भी है, cirrhosis also co-infection is rare, so superinfection is much more. Hepatocellular carcinoma भी rare है और superinfection में much more है, co-infection में rare है, तो superinfection is always higher. Mortality rate of co-infection is less, rarely happens. Mortality rate of superinfection is more than 20%. Diagnosis of co-infection is done on the basis of HBS antigen, okay. Anti-HBC हो जाएगा the core antigen of HBC IgM and anti HDV होगा IgM. Okay, और HDV RNA रहेगा बस. Simple. Diagnosis of this will be HBS antigen, HBE antigen होगा because यहाँ पे ongoing चल रहा है ना, तो HBE antigen आ जाएगा इधर, और बाकी सब सेम रहेगा. एंटी HBC IgG हो जाएगा और एंटी HDV हो जाएगा apparently. This is a bit weird. और HDV RNA तो रहेगा. Okay. So laboratory diagnosis of co-infection will be like, if you have an IgM anti-HBC, this is coming from hepatitis B, and an IgM anti-HDV right now, then it indicates co-infection. Now if you have an IgG anti-HBC and a mixture of IgM and IgG of anti-HDV, then it indicates a super infection. Okay. So yeah, that's it. Epidemiologically, endemic areas, okay, close personal contact में हो जाता है and everything. This is not that important. Anyway, so this was the main part of hepatitis D. Okay, hepatitis C is also kind of important, but not really. Okay, it belongs to the hepatitis C is the most common cause of post-transfusion hepatitis in developing country. Post-transfusion means blood transfusion के बाद. Hepatitis C is classified as Flaviviridae का family में पड़ता है. It contains a positive single-stranded RNA. Okay. Transmission is mode of transmission of HCV are as follows. Parenteral होता है, बाहर से लेना, contaminated needle, sharp pricks, injection or drug users, organ transplant, and basically main is blood transfusion or organ transplant. Vertical transmission of infected mother to children. Sexual transmission, hepatitis C does not spread to sexual transmission. Okay. At least breast milk, food, casual kissing and hugging, it doesn't spread. Clinical manifestations, incubation period is about 15 to 160 days, average 50 days पकड़ के चलो. And asymptomatic like basically 2 month तो पकड़ के चलो, ठीक है. Asymptomatic infection is seen, okay, it's not very symptomatic. Acute hepatitis is seen in around 20% of people. Okay. Spontaneous clearance, like the virus gets cured spontaneously in 12 weeks, within a few weeks you can say. Chronic disease, chances of developing a chronic disease is about 75 to 85%. Like, anyways, like there are chances of developing chronic disease. You can write in the answer, and then you can say chronic hepatitis, cirrhosis, and HCC can be happening. Okay, extrahepatic manifestations can be there, like mixed cryoglobulinemia and glomerulonephritis and everything. This is it. HCV, I don't want to study that much honestly. I would say यहाँ से ज़्यादा question आएगा भी नहीं. I don't think so. So yeah, that's it.